Not all fruits are created equal, especially when it comes to seniors' health. While fruits are generally packed with nutrients, some can pose unexpected risks. From interfering with medications to causing digestive issues, certain fruits should be avoided. Overconsumption of specific fruits can also affect blood sugar levels or exacerbate other health conditions. Stay tuned as we uncover the top 5 fruits seniors should steer clear of and provide tips on how to make healthier fruit choices to support their well-being. Welcome. I'm a doctor from Golden Years Health Hub, and today we're diving into the surprising world of fruits that might not be as healthy for seniors as you think. While fruits are typically packed with vitamins and minerals, some can pose unexpected risks to seniors. From affecting digestion to interacting with medications, certain fruits can have adverse effects. In this video, we'll explore the fruits that seniors should be cautious of, the reasons behind the potential harm, and how to make informed choices to maintain a balanced, health-boosting diet. As we age, our bodies undergo changes that can impact how we process and absorb nutrients, and some fruits may exacerbate these changes. Certain fruits can cause digestive discomfort, spike blood sugar levels, or even interfere with heart and kidney medications. We'll also discuss alternatives that are safer and more beneficial for senior health, ensuring they get the nutrients they need without risking their health. Eating for your age is important, and choosing the right fruits can support your body in managing the natural changes that come with aging. Let's get started on understanding how some fruits, despite their benefits, might not always be the best choice as we age. Stay tuned to uncover which fruits to avoid and how to incorporate better options into your daily diet for optimal well-being. As we age, our bodies undergo various changes that can affect how we process and absorb nutrients. This makes it crucial to be mindful of the foods we consume, as some fruits can interfere with medications or exacerbate health conditions common in seniors. One of the most well-known examples is grapefruit. While it's rich in vitamin C and antioxidants, grapefruit contains compounds called furanocoumarins that can interfere with the enzyme CYP3A4 in the intestines. This enzyme is responsible for breaking down many medications. When grapefruit inhibits this enzyme, it can lead to higher levels of certain drugs in the bloodstream, increasing the risk of side effects. Medications affected by grapefruit include statins, used to lower cholesterol, blood pressure medications, anti-anxiety drugs, and some antihistamines. Other citrus fruits, such as pomelos and Seville oranges, can also have similar effects due to their furanocoumarin content. Therefore, it's advisable for seniors taking medications metabolized by CYP3A4 to consult their healthcare providers about consuming these fruits. In addition to citrus fruits, certain other fruits can pose risks. For instance, bananas and other potassium-rich fruits can be problematic for individuals taking ACE inhibitors or potassium-sparing diuretics, as they may lead to elevated potassium levels, a condition known as hyperkalemia, which can affect heart function. Furthermore, fruit juices, especially when consumed in large quantities, can interact with medications. They may affect the absorption and metabolism of certain drugs, potentially altering their effectiveness. It's essential for seniors to be aware of these potential interactions and to discuss their diet with healthcare providers, especially when starting new medications or experiencing changes in health status. By making informed dietary choices, seniors can better manage their health and reduce the risk of adverse effects from food and medication interactions. Fruit number 1, grapefruit. Grapefruit contains a group of naturally occurring compounds, most notably furanocoumarins, that can inhibit the activity of certain enzymes in the small intestine and liver responsible for the first-pass metabolism of a wide variety of medications. One of the primary enzyme systems affected is cytochrome P450-3A4, CYP3A4, which plays a critical role in the oxidative metabolism of many drugs. Under normal circumstances, these enzymes act as gatekeepers, converting active pharmaceutical ingredients into more water-soluble metabolites that can be efficiently excreted from the body. When grapefruit juice or significant quantities of grapefruit fruit are consumed, however, the inhibitory effects of furanocoumarins can lead to a pronounced reduction in CYP3A4 activity. As a result of this enzyme inhibition, Medications that would ordinarily be metabolized and cleared at a predictable rate may instead accumulate to higher than intended concentrations in the bloodstream. This phenomenon is sometimes referred to as the grapefruit effect and can have serious clinical consequences. For example, blood levels of certain calcium channel blockers, such as felodipine or nifedipine, statins, including simvastatin and atorvastatin, benzodiazepines like midazolam, and immunosuppressants, for instance, cyclosporine, can rise dramatically by as much as 300 to 400% in some studies if ingested in close temporal proximity to grapefruit. Elevated plasma concentrations of these drugs may increase the risk of dose-dependent adverse effects such as hypotension, muscle toxicity, myopathy or rhabdomyolysis, excessive sedation, or nephrotoxicity. Importantly, the grapefruit drug interaction is not limited to grapefruit alone. Other members of the citrus family, such as Seville oranges, pomelos, and tangelos, also contain furanocoumarins and can exert similar inhibitory actions on CYP3A4. However, sweet oranges, tangerines, and other citrus fruits generally lack the same levels of inhibitory compounds and do not produce as significant an effect. That said, because individual responses can vary, it is often recommended that patients taking medications with a narrow therapeutic index avoid all unspecified citrus juices unless the specific safety profile has been established. The onset of grapefruit's inhibitory effect on CYP3A4 can occur rapidly, within 1 hour of ingestion, and the impact may persist for up to 24 hours or longer since the affected enzymes must be resynthesized by the body before normal metabolic capacity is restored. This prolonged duration means that even a single glass of grapefruit juice consumed in the morning could influence drug metabolism for the remainder of the day. Repeated daily consumption can lead to a sustained reduction in enzyme activity, compounding the risk of higher than expected drug levels and subsequent toxicity. Clinical management strategies for patients who consume grapefruit regularly include either substituting with non-interacting fruit juices, such as apple or cranberry juice, or selecting alternative medications that are not primarily metabolized by CYP3A4. Healthcare providers may also choose to adjust drug dosages under careful monitoring, but this approach requires more frequent blood tests and close observation for signs of both subtherapeutic and supertherapeutic drug effects. In some cases, the risks associated with grapefruit drug interactions are sufficiently great that healthcare professionals provide explicit warnings on medication labels or patient information leaflets. It is also worth noting that grapefruit can affect not only oral medications, but also certain topical or inhaled drugs. Fruit number 2, starfruit. Starfruit, Avaroa carambola, a tropical fruit prized for its distinctive shape and tangy sweet flavor, contains several biologically active compounds that can pose a serious risk to individuals with impaired renal function. Chief among these is caramboxin, a neurotoxin that is normally cleared efficiently by healthy kidneys, but can accumulate to dangerous levels in those with kidney disease. In patients whose glomerular filtration rate is reduced, even small amounts of starfruit or its juice may precipitate a rapid rise in systemic neurotoxin concentrations, triggering a spectrum of neurologic symptoms that range from mild confusion to life-threatening seizures. Mechanistically, caramboxin acts as an agonist at central nervous system glutamatergic receptors, particularly the N-methyl-D-aspartate, NMDA, and A-amino-3-hydroxy-5-methyl-4, isoxazoline acid, AMPR, receptors, thereby causing excessive excitatory neurotransmission. In healthy individuals, efficient renal clearance prevents the buildup of this compound, and transient exposures to dietary starfruit rarely produce discernible effects. However, in the context of chronic kidney disease, CKD, or acute renal failure, diminished filtration and secretion lead to prolonged circulation of caramboxin. The result is neuronal hyperexcitability, which clinically manifests as cognitive disturbances, altered mental status, hiccups, and, in severe cases, generalized tonic-clonic seizures. Clinical reports have documented the rapid onset of neurotoxic symptoms within hours of starfruit ingestion in susceptible patients. A series of case studies described individuals on dialysis who developed intractable hiccups progressing to confusion and myoclonus after consuming starfruit juice. Some even experienced status epilepticus that required intensive care management. Laboratory analyses in these cases revealed elevated plasma levels of caramboxin, confirming the causal link. Moreover, because caramboxin and certain oxalate compounds present in starfruit both accumulate in renal impairment, there may be additive effects contributing to neurotoxicity and nephrocalcinosis in predisposed patients. Beyond caramboxin, starfruit contains a high concentration of oxalates, which can form calcium oxalate crystals and exacerbate renal injury. These sharp crystals may deposit within renal tubules, causing additional tubular damage in CKD or precipitating acute oxalate nephropathy in individuals with borderline kidney function. Thus, patients with pre-existing renal impairment face a dual risk: direct neuronal excitation from caramboxin and further deterioration of renal function from oxalate overload. Prevention of starfruit-related neurotoxicity hinges on strict dietary avoidance in at-risk populations. Nephrology societies and renal dietitians routinely counsel patients with chronic kidney disease stages 3 to 5, as well as those on hemodialysis or peritoneal dialysis, to eliminate starfruit from their diets entirely. Education materials emphasize that even a single fruit or a modest glass of juice can trigger severe reactions. Caregivers and family members should also be informed, since patients with advanced renal disease may not recognize the source of their emerging neurologic symptoms. Management of acute starfruit intoxication focuses on rapid removal of the offending toxin. Continuous renal replacement therapy, CRRT, or high-flux hemodialysis, has been shown to effectively clear caramboxin and reduce neurotoxin concentrations, leading to swift clinical improvement. Supportive care, such as benzodiazepines for seizure control, intravenous fluids for hydration, and close monitoring of electrolytes is essential. Fruit number 3, dried fruits. Dried fruits, including raisins, dates, apricots, figs, prunes, and many others, offer a convenient, shelf-stable source of vitamins, minerals, and dietary fiber. However, the dehydration process used to preserve these fruits concentrates their natural sugars and calories. Water, which normally accounts for over 70% of a fresh fruit's weight, is removed, leaving behind a small package that can contain 3 to 5 times the amount of sugar found in the same weight of the fresh version. As a result, a handful of raisins might deliver the equivalent sweetness and caloric load of nearly a cup of fresh grapes, and just 2 large medjool dates can contain as many calories as a small candy bar. When consumed, the dense sugar content of dried fruits can cause rapid increases in blood glucose levels, particularly in individuals with insulin resistance or diabetes. Even though dried fruits retain fiber, which slows carbohydrate absorption, the physical concentration of carbohydrates and reduction in water content mean that the glycemic load per serving is often substantially higher than that of fresh fruit. For someone monitoring blood sugar, it can be easy to underestimate the impact. A quarter cup of dried apricots contains roughly 25 grams of carbohydrate, comparable to a medium banana, yet takes up far less volume in the stomach and may be swallowed more quickly and in greater quantity. This can lead to postprandial blood sugar spikes, triggering compensatory insulin responses, subsequent blood sugar drops, and a cycle of hunger and cravings that further complicate glycemic control. Beyond effects on blood sugar, the caloric density of dried fruits can also contribute to unintended weight gain when portions are not carefully monitored. Whereas a cup of fresh berries or melon provides a satisfying volume of low-calorie food, dried fruit yields a far smaller portion for the same calorie count, often 100 to 150 calories in a small handful. When incorporated into trail mixes or snack mixes with nuts, chocolate, or seeds, these calories can accumulate quickly. It's all too common to consume 250 to 300 calories in a few minutes without realizing it, especially during social events, movie viewing, or while multitasking. Over time, these surplus calories add up, tipping the energy balance toward weight gain. The fructose content of many dried fruits brings additional metabolic considerations. Unlike glucose, which triggers insulin release directly, fructose is primarily metabolized in the liver, where large amounts can be converted into triglycerides. Excessive fructose intake has been linked to increases in blood triglyceride levels, fatty liver deposition, and the development of insulin resistance over the long term. While fresh fruit generally contains moderate levels of fructose balanced by fiber, water, and polyphenols, the concentrated form found in dried fruits can stress hepatic metabolism when consumed in large amounts, particularly if an individual's overall diet is already high in added sugars. That said, dried fruits are not inherently bad. They are rich in micronutrients, potassium, magnesium, iron, vitamin A precursors in apricots, and antioxidants such as phenolic compounds that may contribute to heart health, gastric motility, and reduced oxidative stress. In cultures around the world, dried fruits have long been valued for these properties, as well as for their portability and long shelf life. The key to integrating them into a balanced diet lies in portion control and context. Fruit number 4, bananas. While bananas are indeed packed with essential nutrients, such as potassium, vitamin B6, vitamin C, dietary fiber, and various phytonutrients, their relatively high sugar content and moderate glycemic index can pose challenges for seniors who need to manage their blood glucose levels carefully. On average, a medium banana, about 118 grams, contains roughly 14 grams of naturally occurring sugars, primarily sucrose, glucose, and fructose, and delivers approximately 105 calories. For a younger, healthy individual with robust insulin sensitivity, this sugar load can be accommodated without significant glycemic excursions. However, in older adults, especially those with insulin resistance or type 2 diabetes, each gram of carbohydrate matters, and frequent or large servings of banana may contribute to larger postprandial blood sugar spikes. Glycemic index and ripeness. The glycemic index, GI, of banana varies depending on its ripeness. Green unripe bananas boast a GI around 30 to 40, owing to their higher resistant starch content, which escapes digestion in the small intestine and instead ferments in the colon, acting like dietary fiber. As bananas ripen, resistant starch converts to simpler sugars, raising the GI to approximately 50 to 60 for fully yellow bananas and potentially higher if brown spots appear. For a senior striving for stable glucose, unripe or slightly green bananas may be preferable since they provoke a gentler rise in blood sugar. Nevertheless, these firmer bananas can be harder to chew and digest, which may limit their palatability and tolerability in older individuals with dental issues or diminished digestive enzymes. Portion control and pairing. Given the sugar density of banana, moderation is key. Rather than consuming an entire medium banana, which could equate to 15 to 20 grams of total carbohydrates, seniors might opt for half a banana alongside a source of protein or healthy fat, such as a tablespoon of peanut or almond butter, a small handful of nuts, or a serving of Greek yogurt. This combination slows gastric emptying, blunts the glycemic response, and promotes satiety. For example, pairing half a banana, approximately 50 calories, 7 grams sugar, with 2 tablespoons of natural nut butter, approximately 200 calories, negligible sugar, yields a balanced snack that provides fiber, protein, and heart-healthy monounsaturated fats, all of which support more gradual glucose absorption. Nutritional benefits. Beyond sugars, bananas do offer benefits that are particularly relevant to seniors. Their high potassium content, about 422 milligrams per medium fruit, supports cardiovascular health and helps regulate blood pressure, an important consideration as vascular elasticity diminishes with age. Vitamin B6 contributes to cognitive function and neurotransmitter synthesis, potentially mitigating age-related declines in memory and mood. Bananas also contain prebiotic fibers, such as inulin and resistant starch, that nourish beneficial gut bacteria, which can bolster immune function and improve gastrointestinal regularity, two areas often compromised in older adults. Monitoring and medical guidance. Seniors with prediabetes or diabetes should monitor their blood glucose before and 2 hours after consuming banana to gauge individual tolerance. Continuous glucose monitors, CGMs, can be particularly illuminating, revealing patterns of glycemic variability that inform dietary adjustments. Fruit number 5, pineapple. Pineapple is a notably acidic fruit with a typical pH between 3 and 4, making it capable of irritating the stomach lining and lower esophageal sphincter, LES, in susceptible individuals. Its high citric acid content can exacerbate gastroesophageal reflux disease, GERD, by relaxing the LES and allowing gastric acid to flow back into the esophagus. Elderly adults are particularly vulnerable. As people age, physiologic changes, such as decreased LES tone, delayed gastric emptying, and reduced salivary buffering, predispose them to more frequent or severe reflux episodes. Studies show that approximately 14 to 20% of individuals aged 60 and older experience weekly heartburn, and prevalence in outpatient elderly cohorts can exceed 20%. Managing pineapple-induced reflux in seniors involves portion control, pairing with non-acidic foods, cooking or processing methods that reduce acidity, and considering low-acid fruit alternatives. Fresh pineapple contains substantial amounts of citric and malic acids, which contribute to its tangy flavor and low pH of roughly 3.0 to 4.0. For reference, a neutral substance has a pH of 7, so pineapple's acidity is comparable to that of many citrus fruits, making it a potential reflux trigger. While pineapple also supplies beneficial nutrients, such as vitamin C, manganese, and the proteolytic enzyme bromelain, these do not neutralize its inherent acidity, which remains the primary concern for GERD sufferers. Acid reflux occurs when the LES fails to maintain its barrier function, allowing stomach acid to migrate upward into the esophagus and irritate its lining, causing heartburn and discomfort. Pineapple's high acidity can further weaken the LES, reducing its resting pressure and prolonging esophageal acid exposure. Additionally, acidic foods stimulate gastric acid secretion, potentially increasing overall intragastric acidity and the likelihood of reflux events. The combination of decreased LS tone and heightened gastric acidity forms a perfect storm for triggering or worsening reflux symptoms. Increased susceptibility in seniors. Aging brings multiple changes that heighten vulnerability to acid reflux. LES relaxation and hiatal hernia. Age-related laxity of diaphragmatic and phrenosophageal ligaments can lead to hiatal hernia formation, further compromising the anti-reflux barrier. Delayed gastric emptying. Elderly patients often exhibit slower gastric motility, prolonging the time acidic contents remain in the stomach and increasing reflux risk. Reduced salivary and mucosal defense. Diminished saliva production and mucosal bicarbonate secretion impair chemical buffering of refluxed acid. Prevalence data. Community studies report that up to 20% of seniors have weekly reflux symptoms, with many underreporting mild heartburn but facing a higher incidence of complications like erosive esophagitis. Lifestyle tips. Eat upright. Remain seated for at least 30 minutes after consuming pineapple to use gravity to keep acid in the stomach. Avoid lying down before bed. Do not recline or lie flat for at least 3 hours post-snack to prevent nocturnal reflux. Review medications. Some common medications in seniors, e.g. calcium channel blockers, nitrates, can reduce LES tone. Discuss alternatives with a healthcare provider if reflux worsens. Conclusion. While pineapple's nutrients and bromelain content offer health benefits, its low pH makes it a potent trigger for acid reflux, especially in older adults who already face age-related LES weakening and delayed gastric emptying. To recap, the top 5 fruits seniors should avoid are grapefruit, starfruit, dried fruits, bananas, and pineapple. Opt for safer alternatives like berries, apples, and pears. Thank you for joining us. If you found this information helpful, please like, share, and subscribe for more health tips tailored for seniors. Remember, making informed choices can lead to a healthier, happier life.